Hello everyone. I am Docsaab, and today we are going to embark on a comprehensive deep dive into a critical and increasingly prevalent global health challenge, polypharmacy. This presentation aims to provide medical students and doctors with a thorough understanding of its risk management strategies and broader societal impact. We will explore why this phenomenon is growing and what we can do about it. Let's start by defining what we mean by polypharmacy. While there isn't one universally agreed upon definition, the most commonly accepted threshold and the one we will largely use today is the routine use of 5 or more medications concurrently. This isn't just about prescription drugs, it critically includes over the counter medications, herbal remedies, and other complementary medicines. This holistic view is essential because all these agents can interact and contribute to the overall medication burden. The lack of singular standardized definition can sometimes complicate research and clinical comparisons. However, what is clear is its significant and growing global epidemiology. We see variability in its prevalence across different demographics, age, gender, socioeconomic status, and also across various healthcare systems and regions. For instance, global prevalence in the general population is estimated around 37%, but this figure rises dramatically in specific populations, which we will discuss shortly. Understanding these nuances is crucial for grasping the true scope and scale of this complex problem. The clinical consequences of polypharmacy are profound and represent a critical patient safety and health burden. First and foremost, polypharmacy significantly increases the risk of adverse drug reactions and serious drug-drug interactions. With each additional medication, the probability of an unforeseen interaction or an adverse event climbs aggressively. This increased medication burden is strongly linked to several other detrimental outcomes. We've seen an increased risk of falls, particularly in older adults, due to medication affecting balance, cognition, or blood pressure. Closely related is the risk of cognitive impairment, ranging from mild confusion to delirium, and even accelerating the progression of dementia. For our patients, these issues often translate into higher rates of hospitalization and even increased mortality. Polypharmacy is a consistent predictor of unplanned hospital admissions and emergency department visits. Furthermore, managing multiple medications can lead to reduced adherence. Patients simply can't keep track or they experience side effects that deter them from taking their medications as prescribed. This in turn can contribute to overall functional decline and reduce quality of life. These adverse outcomes are particularly devastating in vulnerable populations such as the elderly, individuals with multiple chronic comorbidities, and those with frailty or cognitive deficits. For these groups, these stakes are even higher, making effective management of polypharmacy is absolutely critical. So, why do our patients end up on so many medications? The etiology of polypharmacy is complex and multifaceted, stemming from both systemic and individual factors. The primary driver is multimorbidity. As individuals age or develop complex health conditions, they often accumulate multiple chronic diseases like hypertension, diabetes, heart failure, and osteoarthritis. Each condition typically warrants its own set of medications, leading to rapid accumulation of prescriptions. Another significant contributor is fragmented healthcare system and lack of communication among prescribers. Patients often see multiple specialists, each focus on their specific organ system or disease, and without adequate coordination, medication can be duplicated or conflicting regimens can be initiated. Age-related physiological changes also play a crucial role. As we age, changes in drug metabolism, distribution, and excretion can necessitate dose adjustment or the addition of new medication to manage age-related health issues, further increasing the pill count. We also face a tension between guideline driven prescribing and actual patient complexity. While clinical guidelines are evidence based and essential, they are often developed for single diseases and don't always account for the intricate interplay of multiple conditions in real world patient. Following a multiple guidelines simultaneously can unintentionally lead to polypharmacy. Finally, patient expectation and self-medication also contribute. Patients often expect a pill for every ill, and they may also self-medicate with over-the-counter products or supplements, sometimes without informing their primary care providers, adding another layer to the medication burden. Let's now focus on where polypharmacy is most concentrated and causes the greatest concern in geriatrics and patients with chronic diseases. The prevalence in older adults is strikingly high. For example, in India, approximately two-thirds of individuals is 65 and older take 5 or more prescription medications. This percentage rises significantly with increasing age, with over 40% of those 85 and older experiencing polypharmacy. For multimorbid patients, the challenges are unique. They not only juggle multiple medications but also contend with complex symptomology, obtain atypical disease presentation, and the cumulative effects of various drug side effects. Managing these patients require an intricate balance of disease-specific guidelines and holistic patient-centered approach. Polypharmacy in this population directly translates to increased risk of frailty and functional impairment. It can accelerate physical decline, reduce independence, and significantly impact a patient's ability to perform daily activities. Ultimately, this affects their quality of life and demands intensive care coordination. Without careful management, patient can become disengaged from their care, leading to further complications and spiraling declining health and well-being. Understanding this population-specific risk is vital for tailoring effective interventions. Now, let's turn our attention to the practical side. How do we assess and manage polypharmacy? We have a growing arsenal of tools and tactics. For assessment, we utilize several validated tools. Explicit criteria like the BEERS criteria help identify potentially inappropriate medications in older adults, while stop and start criteria guide us in both stopping harmful drugs and initiating beneficial ones that might be missing. Implicit criteria such as the medication appropriateness index offer a more individualized patient specific review. Innovations include automated tools like MyForta, which provides validated automated assessments and medication schemes proposals for older individuals, and risk scores like the Drug Burden Index, which quantifies exposure to sedative and anticholinergic medications and can facilitate deprescribing. Once identified, the core strategy is deprescribing. The fundamental principle of deprescribing are rooted in patient-centered approach. It's about identifying and discontinuing medications where the potential harms outweigh the benefits, always aligning with patient goals of care and preferences. This requires a systemic process. First, a comprehensive review of all medications. Second, thoughtful tapering plans to avoid withdrawal or disease exacerbation. And third, careful monitoring for both intended and unintended effects. Deprescribing is not about reducing pills for the sake of it, but optimizing medication regimens. Finally, interdisciplinary collaboration is key for success. This involves physicians, pharmacists, nurses, and other healthcare professionals working together to identify, review, and implement deprescribing strategies, ensuring a holistic approach to medication management. Beyond the clinical impact, polypharmacy carries a hefty price tag for healthcare systems and society as a whole. From a global perspective, the World Health Organization estimates that suboptimal prescribing, a direct consequence of polypharmacy, contributes to approximately 4% of the world's total avoidable healthcare cost. This is a staggering figure highlighting the immense economic burden. Looking at individual patients, particularly seniors, polypharmacy is associated with significantly increased medical cost. Studies have shown that polypharmacy can lead to annual medical costs that are thousands of dollars higher per senior compared to those without polypharmacy, encompassing both pharmacy and other medical expenses. This is also translates to higher resource utilization. Patients on multiple medications are more likely to experience adverse events, leading to increased hospitalization and emergency department visits, further straining healthcare resources. The societal implications extend beyond financial cost. Polypharmacy can severely impact a patient's quality of life, leading to functional decline and reduced independence. Furthermore, it creates a significant caregiver burden as family members often struggle to manage complex medication schedules and cope with adverse effects their loved ones experience. Addressing a polypharmacy is not just a clinical prudence, it is an economic imperative. Recognizing the escalating problem, regulatory bodies and policymakers worldwide are increasingly engaged in managing polypharmacy. The WHO initiatives and international guidance play a crucial role in setting global standards and encouraging member states to develop their own policies on medication safety, often including specific guidance on polypharmacy. This global collaboration underscores the universal nature of the challenge. At the national level, we see various national policies on medication safety being implemented. These often include strategies to promote rational prescribing, enhance medication reconciliation, and reduce medication errors, all of which indirectly or directly impact polypharmacy. Crucially, the role of deprescribing guidelines and standard for medication review is gaining prominence. These guidelines provide evidence-based frameworks for healthcare professionals to systematically review and reduce inappropriate medications. Establishing clear standards for medication reviews ensure consistent and high-quality medication management across healthcare settings. However, there are still regulatory gaps to address. These might include inconsistent implementation across different healthcare sectors, lack of mandatory training, or insufficient funding for comprehensive medication management services. Future policy directors are likely to focus on strengthening interdisciplinary collaboration, leveraging digital health solutions, and prompting patient and public education to create a more informed and proactive approach to polypharmacy management. Finally, let's look at the horizon. What innovations and future directions are shaping polypharmacy research and management? Technology is a powerful ally. AI and machine learning are being harnessed for real-time risk prediction and pharmacovigilance, moving beyond traditional systems to proactively identify multi-drug harm. Imagine AI models predicting polypharmacy risk based on the longitudinal patient data. Wearable devices are also emerging. Beyond just fitness tracking, these devices can monitor subtle side effects of polypharmacy like gait disturbances and play a crucial role in improving medication adherence by influencing patient behavior. Pharmacogenomics is paving the way for truly personalized prescribing. By understanding a patient's individual genetic makeup, we can optimize drug choice and doses, minimizing adverse effects and maximizing efficacy, thereby reducing the need for additional medications to counteract side effects. There is ongoing development of novel prevention and management approaches, constantly seeking new ways to streamline medication regimens and prevent unnecessary prescribing. This includes innovative drug delivery systems and non pharmacological interventions. Lastly, strengthening interdisciplinary care models and defining clear research priorities will be crucial. This involves fostering collaboration among all healthcare providers and directing research towards understanding the long term effects of deprescribing, identifying new biomarkers for drug interactions, and developing effective health system interventions. These advancements hold the promise of significantly improving patient outcomes in the face of polypharmacy. To conclude, let's summarize our key findings and look at actionable recommendations. Polypharmacy is a pervasive and escalating global health challenge with severe clinical consequences, including adverse drug reactions, falls, cognitive impairment, hospitalizations, and increased mortality. Its complex etiology spans multimorbidity, fragmented care, and age related physiological changes, imposing a substantial economic burden on healthcare systems and significantly impacting patients' quality of life. Based on this, I offer 7 key recommendations. Standardized definition and enhanced surveillance. We need a consistent definition of polypharmacy to improve data collection and establish robust surveillance programs. Promote interdisciplinary care, foster seamless communication and collaboration among all healthcare providers involved in patient care to ensure coordinated medication management. Integrate comprehensive medication reviews, implement routine, thorough medication reviews for high risk patients utilizing validated assessment tools. Prioritize deprescribing initiatives, actively promote and integrate evidence based deprescribing guidelines into clinical practice, always with patient centered approach. Leverage technology, invest in AI and utilize AI, wearable devices, and pharmacogenomics for proactive risk prediction, monitoring, and personalized prescribing. Strengthen policies. Governments and health organizations must fortify regulatory frameworks, address existing gaps, and ensure effective implementation of policies to manage polypharmacy. Increase patient and public education, empower patients and caregivers with knowledge about polypharmacy risk and the benefits of active participation in the medication management. By collectively addressing these areas, we can mitigate the risk of polypharmacy, improve patient safety, and enhance the overall quality of healthcare. Thank you for your attention and engagement during this presentation, guys. We hope this comprehensive overview of polypharmacy has been informative and will aid you in your clinical practice. For more insights and educational content, Please like, share, and subscribe to the Docsaab's Diary.